Well, good morning, guys. I am just pre-caffeining here with my mango matcha green tea from the Matcha Reserve with 1 packet of sweet leaf stevia in it. Totally loving this stuff. It's really good, and I've totally been enjoying it in my Totoro mug here, whose little green dots nicely match the tea. And look how cute he is with his little head here. But as I mentioned last week in my Dr. Jart's Cicapair Tiger Grass Cream review, where I talked about green tea and skincare, I'm going to be talking today about niacinamide in moisturizers. Many of the moisturizers that I use on my face and body contain niacinamide. I think it's a good ingredient, and many of you have asked me to talk about it a little bit more in terms of what skin conditions it's helpful for. But niacinamide is a water-soluble B vitamin, vitamin B3, and it is essential to the coenzymes that play a role in over like 200 different types of reactions in our body. So it's really, really important for our physiology. It's an inexpensive ingredient. It's very well tolerated, appears to be safe when applied topically on the skin with no reported serious adverse consequences. I'm not aware of any reports of allergic contact dermatitis to topical niacinamide. And so it behooves skincare companies to put it in their products for those reasons. Skin conditions that this ingredient has been demonstrated to be useful for, I will review in a little bit more detail, but they include things like dry skin, eczema on the face, dark spots and melasma, as well as acne and oiliness and shininess. Okay, so if you're somebody who has oily, shiny skin, you will be excited to learn that niacinamide as a skincare ingredient can be helpful for you. And it's also been demonstrated to be a really helpful ingredient for people who suffer from rosacea, which if you're not familiar with what rosacea is, I have a Q&A on that skin condition, which I'll list down below that you should check out. But essentially it is a skin condition in which individuals are very sensitive to things applied to the face. They get red, they flush, they can develop acne-like bumps on the skin. It can be a really problematic skin condition that looks like acne, but it is not acne. And the fact that it's helpful for rosacea, to me, really underscores the fact that it's a very well tolerated ingredient, because people with rosacea are very, very sensitive to many ingredients. And then many of you are always interested in anti-aging claims and what the evidence is for an anti-aging role. What comes to mind for me when I think of anti-aging and things that are going to protect you against aging, I think about things that are going to combat the effects of ultraviolet radiation on our skin, namely the deeper layers of our skin as well as the top layer of our skin. Free radical oxidation that damages the deeper collagen framework, and more importantly, so things that could potentially be protective against ultraviolet radiation mediated skin cancer development, which is a huge problem in this day and age, and responsible for quite a bit of our healthcare dollar budget, and can be a real problem for the individual plagued with these skin cancers. However, like most ingredients in skincare products, this is a non-drug, so it's not regulated in the same manner as, say, salicylic acid or benzoyl peroxide. If you'll notice, those ingredients are often listed as active ingredients with the name like acne medication next to them. And so they're regulated a little bit more strictly in terms of demonstrating efficacy and safety. Unlike vitamin C and your vitamin C serums, unlike the green tea, niacinamide is actually pretty stable. It's very stable and it's water soluble, so it does quite well in terms of stability in skincare products and applied topically on the face. It's a little bit more reliable, and like I said, it tends to not be too offensive. But like I said, it is a non-drug, so you are a little bit at the mercy of the skincare company that they have put a good niacinamide in their product, and that it's there in a appreciable amount, and you know, it's not degraded it or something like that. So you're a little bit at their mercy, but like I said, it's inexpensive, and it's not something that is, you know, pushed in kind of expensive things. It's often present in expensive moisturizers, but it's really not the selling point, if you will. As far as skin conditions that niacinamide is helpful for, I'll get into that now. So with regards to acne, so first up, there's a Japanese study that showed that Japanese patients with acne who applied a 2% niacinamide cream topically to the face had measurable decreased amounts of oil after 2 to 4 weeks of consistent use. Subsequent to that, there was a study in 30 Caucasians with acne demonstrating a decrease in acne lesions with topical niacinamide. There are also other acne studies showing a statistically significant decrease in the number of acne lesions after, you know, upwards of 8 weeks of consistent use of topical niacinamide. But probably some of the most compelling to me is a double-blind study showing that individuals with acne who used a niacinamide cream had just as much improvement in their acne at 8 weeks as individuals with the same extent of acne who used a clindamycin cream for 8 weeks. They both had the same amount of improvement in their acne. And the reason that I say this is that clindamycin is a common and standard of care acne medication. So it's something that we kind of have a benchmark for in terms of it is effective for acne. It's typically prescribed along with benzoyl peroxide. It's a topical antibiotic that, in addition to being an antibiotic, has profound anti-inflammatory effects that help acne. Okay, so it's a good medicine for acne. One of the problems with clindamycin, however, is that because it's an antibiotic, the bacteria that normally live on our skin can develop bacterial resistance to it with long-term use. And so, you know, that's why it's often prescribed along with benzoyl peroxide to reduce the chances of that occurring. But it is a risk of using this prescription medication, okay? But in the study that I mentioned, in which one group was using niacinamide, that group had just as much improvement in their acne as the group using the clindamycin antibiotic. However, niacinamide does not portend any risk of bacterial resistance, okay? So that's compelling to me. We know that niacinamide applied topically can inhibit some of the biology of how pigment is transferred from the pigment-producing cells to the skin cells, or keratinocytes. This biologic process it underlies a lot of persistent hyperpigmentation after inflammatory lesions of acne have healed, and is an ongoing source of problems in individuals with melasma, okay? So we know that niacinamide can nicely interfere with that process and improve these conditions and impart a brightening effect. And if you did get a chance to view my dark spots and melasma video, in that video I mentioned that a cornerstone of melasma treatment is 4% hydroquinone. I discussed that cream, its safety, its limitations, etc. It's a good cream and it has robust evidence for improving melasma, okay? It's sort of the standard of care. There was a double-blind study in which people with melasma applied a 4% hydroquinone cream to one half of their face and a 4% niacinamide containing cream to the other half of their face, okay? They did that for 8 weeks, okay? So way to be a trooper. And at the end of the study, there was similar improvement in both sides of the face. However, the side of the face getting the niacinamide had far less irritation and far fewer side effects than the side of the face getting hydroquinone. So if you'll remember back to my video, and if you've ever used hydroquinone, you know that A, it kind of smells funny, am I right? And B, it's very irritating, okay? So much so also that if you put it on and you go out in the sun, all that irritation is actually going to make your melasma worse. So it's kind of a battle with hydroquinone. It can be very irritating, okay? But the niacinamide in this study seemed to do just as well, but without that level of irritation, okay? In last week's Q&A on dry skin and how to moisturize the body, I mentioned that one of the salient features of dry skin is an increase in transepidermal water loss, okay? That's what contributes to persistent dry skin. And if you're somebody who suffers from the condition atopic dermatitis or eczema, this is a real critical component of the pathophysiology of your disease. And it's been demonstrated that a moisturizer containing niacinamide, when applied twice a day to people with dry skin and people with eczema, significantly improves the top layer of the skin's hydration in objective measurements, and also objectively decreased the degree of transepidermal water loss. So in conclusion, it's a good ingredient for keeping the skin barrier hydrated and cutting down on transepidermal water loss. Additionally, in this study, they demonstrated that there was some increased collagen synthesis in the deeper layers of the skin and an improvement in the fat composition of the top layer of the skin. Therefore, niacinamide in a moisturizer for dry skin kind of improves the overall biologic composition of the top layer of the skin in people with a tendency towards dry skin, and can kind of help get them back on track a little bit for having a good skin barrier. And with regards to rosacea, I mentioned that earlier, it's been demonstrated that niacinamide applied topically to rosacea patients can actually significantly improve the persistent redness of rosacea, as well as can decrease the number of inflammatory red bumps on the skin of people with rosacea. And it seems to be very well tolerated in rosacea patients. So it's a good ingredient and a moisturizer for people with rosacea. And some of the most exciting stuff with regards to topical niacinamide is that kind of in the realm of anti-aging and decreasing ultraviolet radiation mediated damages to the skin. Topically applied niacinamide to the face has been shown to decrease the number of free radicals generated when the skin is exposed to ultraviolet radiation. And as you know, these free radicals generate kind of inflammatory oxygen molecules that destroy our collagen framework and contribute to wrinkles, sagging, drive persistent hyperpigmentation in the skin, and also set the stage for skin cancer development. Furthermore, niacinamide has been demonstrated to decrease the cytokine milieu, or the kind of soup of inflammation that gets brewed up when your skin is exposed to ultraviolet radiation. When niacinamide is applied topically, that can really cut down on that. So, I'm telling you guys this because it's exciting, but do know that no, your niacinamide containing creams are not a substitute for sun protection and sun avoidance behaviors. However, niacinamide can kind of boost that a little bit. Now, one of the things that everyone wants to know about are the side effects of niacinamide applied to the skin, and I think it's interesting, okay? I mentioned that niacinamide is a pretty stable ingredient. It's pretty inexpensive. It's not, any skin off of the skincare company's back, if you will, to put it in their products because it's moisturizing and kind of a no-brainer and affordable to them and easy for them to put in there. I don't know why they don't push it more as far as their advertising. I suppose that they just don't, they want to sell other ingredients in their products, whatever. But there are reports of some side effects, though mild. Namely, some people find that when they use it, their skin burns or stings a little bit when they put it on. And this is interesting because when you go back through the literature on the studies looking at niacinamide in people with melasma, they did report a little bit of stinging and irritation. That's the only, documented study showing, those are the only studies I can find that actually document the side effect from niacinamide of the stinging. And in that study, the people in the study, they continued to use the niacinamide, they continued to use it, they continued to be be able to use it. The stinging wasn't that bad. And then they got used to it, okay? But what I find interesting now that I've been doing YouTube in the comments section is that many of you all say that niacinamide just stings and burns your skin. So I'm really interested in this. So if you are somebody who has used niacinamide, if you wouldn't mind commenting below on if you experienced kind of burning and stinging, and if you did, how long did that last for? How long did you use the product? Did you bail on it after one time, or did you push through and try and use it for a longer period? How long did you use it for? I would really be interested to know that, because I think it's really, you know, interesting to learn from you guys that you experience this. For me, I've had patients, few and far between, really say anything about niacinamide bothering them. I don't know if they're just not telling me, but you know, they don't. I've never really heard that before from anyone other than you guys. So comment below on if that sounds like you, and you know, kind of. If you wouldn't mind sharing your experience with it, I would greatly appreciate it. I think it's interesting, and you know, part of the fun of the comments is we all can kind of learn from each other and kind of share our journey in skincare, if you will. So yeah. But you know, I happen to like niacinamide and moisturizers because it's affordable. It's pretty stable, and while it is a non-drug cosmetic and you are left to the mercy of the skincare company that their niacinamide is in there at an appreciable amount, you know, it seems like a little bit less risky, and it's never something that is pushed in expensive products. It's always, you know, it's often in the expensive products, but it's also almost always in many inexpensive drugstore products that are good and no nonsense. So I think it's one that is worth pursuing if you're not getting too irritated by it and not bothered, you know, not experiencing that stinging and dryness for the reasons that I mentioned. Most compelling to me, just for all comers, you know, if you're not somebody who has acne or oily skin or rosacea or melasma or dark spots or dry skin or atopic dermatitis, if you are somebody with just rockin' skin and not a skincare problem in the world, and you're like, why do I need niacinamide in my life? To me, the most compelling reason would be the fact that there is some data showing that it can, you know, kind of help soften the load, if you will, of some of the damages that we all sustain from ultraviolet radiation that can contribute down the road, not only to aging of the skin, but also to skin cancer. So that to me would be a reason to not totally be like, skip it. But, you know, chances are you probably are putting niacinamide on your face unless you just don't use any skincare products whatsoever. You know, I personally use CeraVe PM's facial moisturizer. It contains niacinamide. I also use their AM sunscreen, moisturizing sunscreen. I believe it also contains niacinamide. Their face washes contain it. You know, most of their products contain it. The one that does not, if you are bothered by it, is a CeraVe moisturizing cream in the tub, and that can go on the face. So if this bothers you too much, try the one in the tub. I will list it down below. There are many other fantastic moisturizers similar to CeraVe that also contain niacinamide. I will list them down below. Eucerin makes some fantastic ones. Comment below on if Eucerin, E-U-C-E-R-I-N, is available to you in your country. I know CeraVe is kind of a U.S. Exclusive thing, and I've been recommending it a lot and leaving you guys out in the rain, if you will, as far as moisturizers. Here in the U.S., this one is pricey for us in our drugstores, but you know, word on the street is it's more affordable in Europe. You know, it's kind of like your drugstore brand, La Roche-Posay. This Tolerian Double Repair Moisturizer, I really love this. It's very nice. I just, you know, I find it a little expensive, and for here in the U.S., I don't find that it offers anything over CeraVe. You know, if this is available to you in your country, it is a great one. Cetaphil's Redness Relief Night Cream, I'm also a fan of, contains niacinamide in it, I believe, as well as a variety of others. I will list these down below for you guys in the description box. And then I'll also list a few nighttime facial moisturizers that I like that don't contain niacinamide if you are super bothered by it, and you're looking for a good night moisturizer that is no nonsense, won't break you out, quote unquote, although I can never guarantee that 100%, but is low likelihood of breaking you out. I will list those down below as well. So yeah. But anyways, guys, I hope you enjoyed this video. I hope it was informative to you guys. Like I said, please comment down below on, you know, if you've used niacinamide in a skincare product, what your experience was with it. I'm so, you know, interested in learning all of this stuff from you guys. I'm going to finish my matcha tea here. Oh gosh, you guys, this stuff is so delicious, and head on out for my work day. So I hope you guys enjoyed this video. Give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.